Welcome to the 2024 Annual Enrollment for Butts County Board of Commissioners. We hope this brief presentation helps you understand the important things you need to know about your employee benefit program. Butts County Board of Commissioners partners with Arista Consulting Group for employee benefits. This includes strategy, analysis, financial well-being, employee support, and benefits technology like our system Employee Navigator. Our partnership with Butts County is very important to us. Arista's goal is to make sure you have the best benefits for your dollar and that you are protecting your financial well-being now and into the future. The healthcare system can be very hard to navigate, and you are not alone. As part of the services offered with our partnership, you have access to personalized and confidential help. Arista's Employee Benefit Assistance contact information is listed below. Feel free to email or call Arista. You may call Arista at 866-370-3119 or send them an email at help@aristacg.com, and someone will reply to you as quickly as possible, usually within 24 hours. Arista is there and ready to assist. Open enrollment is your opportunity to make changes to your benefits without having experienced a mid-year qualifying life event. For example, maybe you elected the high dental plan and realized that you could save money and still get the dental care that you require on the low dental plan. Or you may want to take this time to consider increasing or purchasing life insurance to protect your family, or maybe disability insurance to protect your income in case you had to miss work due to an illness or injury. You may purchase additional life insurance for yourself, your spouse, and your children up to age 26 to the guarantee issue amounts without having to answer any medical questions. You may also elect short-term and/or long-term disability so that you can continue to pay your bills should you need to be out of work for an illness or injury. This includes maternity leave and planned surgeries that are medically necessary. Any changes you choose to make now will be effective July 1st, 2024. We've used the term qualifying life event. In case you're not sure what that means, it is an event that allows you to make a change to your benefit elections in the middle of the plan year outside of your annual open enrollment period. If you experience an event that you think may qualify you to make a change to your benefits during the plan year, please speak with Sharon Robinson in Human Resources. Sharon will guide you about next steps. Some common examples of qualifying life events, or QLEs for short, include marriage or divorce, birth or adoption of a child, losing coverage through your spouse's group plan, or gaining coverage through your spouse's group plan. This year's open enrollment period begins Wednesday, May 22nd, and ends on Friday, May 31st. If you need to make changes to your benefits, you will do that through our benefits administration system, Employee Navigator. You should have received an email already inviting you to participate in open enrollment. If you did not receive an email, please call Arista for help. If you are not making changes to your current coverage, no action is required of you. However, we do encourage you to take a few minutes to go through this quick and easy process. It's a good time to check each year to be sure you have your life insurance beneficiaries assigned properly and your home address and any other demographic or contact information is correct. What's changing? Medical will be a single plan option. We will remain with Meritain using the same Aetna network. If you are enrolled in medical with Butts County today, you will be rolled into the new medical plan regardless of which plan you have today, base or buy-up. Benefits will be enhanced and there will be no increase to current costs for anyone who is enrolled in medical today. For those of you who are currently enrolled in the buy-up medical plan, your costs will be decreasing. For those of you who are currently enrolled in the base medical plan, Your costs will remain the same, but your benefits will be significantly enhanced. Your pharmacy benefits will be changing from Caremark CVS to Welldyne. And because of this change, everyone will be receiving new medical ID cards that reflect the Welldyne prescription information. More information about this change is forthcoming. We will be eliminating the Garner Health Reimbursement Arrangement Program. You have until June 15th, 2024 to file Garner HRA claims for any expenses you incurred between January 1st, 2024 and June 15th, 2024. More communication, details, and reminders will follow. Dental is changing from Cigna to MetLife. You'll be rolled over to the high or low plan with MetLife based on the plan that you have today. Rates with MetLife are slightly lower than your current rates with Cigna for the same benefits. We will be sending out communications with more detailed information and reminders leading up to July 1st. Let's go over the basic elements of your medical plan. We encourage everyone to try using Teladoc Telemedicine 1-800-362-2667 because you pay $0. Use this benefit for non-emergency medical issues, questions, or concerns. Use Teladoc when your primary care doctor is not open, when you're away from home, or can't take off from work to get to the doctor. But maybe you need to speak to your doctor about an ear infection your son has, who may need medication prescribed. The provider that you visit with via Teladoc may prescribe medication, and if they do, you will be charged the applicable copay for the prescription drug that you are prescribed. It is important to develop a relationship with a primary care provider. That doctor is in charge of your care overall and gets to know you and your medical history. He or she can recommend specialist doctors and other things. In addition, when you are sick and you would like to see a doctor quickly, you'll have someone to call for an appointment. They are much more likely to work with you and fit you in if you're an existing patient versus someone that they don't know and is a brand new patient for them. When you see your primary care physician for your regular preventive checkups like your physical exam, normal annual blood work, your well women exam, colonoscopy, etc., you will not be responsible for any share of the cost. That's right, you pay $0 for standard recommended preventive care. However, please keep in mind that if you go to your physical exam and ask about other ailments you may be experiencing, anything about that visit that is not coded as preventive may actually carry an out-of-pocket cost for you. For example, you may be responsible for the $40 copay because your office visit was coded as a diagnostic visit, and any special lab work that may have been ordered may be applied to your deductible. If you go to a specialist provider, such as a cardiologist, rheumatologist, psychiatrist, for example, your copay responsibility is $80 per visit. If you go to an urgent care facility, you will be charged a $100 copay. If your issue is not urgent, try Teladoc first since it is free for you. However, please do not hesitate to go to urgent care or to the emergency room if you are in a true emergency situation. If you go to the emergency room, it will be a $350 copay. If lab work and/or imaging, like MRIs or CT scans, is required for you, those services will go towards your deductible and out-of-pocket maximum. In addition, ambulance transportation, inpatient hospitalization, and outpatient surgical procedures also go towards your deductible and calendar year out-of-pocket maximum. Your plan has a $3,500 calendar year individual deductible and a $7,000 calendar year deductible if you cover dependents. After you have satisfied your deductible, you are responsible for 20% of the costs of medical services and procedures that would normally go towards your deductible. This is called coinsurance. Meritain pays 80% and you pay 20% until you hit your out-of-pocket maximum for the calendar year. Your calendar year out-of-pocket maximum is $8,000 for individual coverage or $16,000 if you cover dependents. An out-of-pocket maximum is the most you will ever pay in a calendar year for covered medical services, procedures, and prescription drugs. In addition to your deductible and coinsurance responsibility, all copays that you pay throughout the year go towards your out-of-pocket maximum for that calendar year. Here's an example of how the out-of-pocket maximum works. Let's say you have employee-only coverage and you incur a medical claim of $1 million. We hope this never happens, but you would be only charged $8,000 for that $1 million claim. Keep in mind that oftentimes people go an entire calendar year without even hitting their deductible at all. They just simply pay their regular office visit copays and/or their prescription drug copays. Or some people may only need preventive care, which is at no charge to you. Effective July 1st, 2024, we have partnered with Welldyne for pharmacy benefits. It's currently Caremark CVS. Because of this change, everyone will receive a new medical ID card reflecting Welldyne's pharmacy information. Please be on the lookout in the mail for envelopes from Welldyne and/or Meritain. Everyone will have 90 days to transition to Welldyne. What does this mean? You'll be able to fill any current prescriptions as you normally do all the way until September 30th, 2024. Until September 30th, 2024, you may receive a letter from Welldyne describing any action that you may need to take. Your prescribing physician may need to make a call to do a prior authorization for a prescription you're currently on. This is very standard when employers change pharmacy management partners. The 90 days gives you time to receive and understand all the communications mailed to you by Welldyne. In some cases, you may be surprised to learn that a prescription drug that you fill today is actually available over the counter. Please expect to receive regular communications between now and July 1st regarding this transition to Welldyne. Communications will be sent via email, text message, and regular mail. Please also be on the lookout for an email containing the link to the Welldyne prescription drug formulary list, where you can look up any medications you may currently be on. There is no separate prescription drug deductible on your health plan. Therefore, you will only be charged the copay for the tier of medication that you are filling. Generic drugs have a $20 copay. Preferred brand drugs have a $45 copay. Non-preferred brand drugs are $80, and specialty drugs, you pay 25% of the cost up to a maximum of $400. You can pay 3 times the applicable copay and get a 90-day supply of medication for certain drugs, including some specialty drugs. Did you know there are ways to save on your prescription drug costs that may be outside of the prescription drug plans that are part of your medical plan? Try solutions like GoodRx to compare costs with what you would pay through your insurance. There's no membership required to download the GoodRx app on your smartphone. Or if you prefer, you can go to www.goodrx.com goodrx.com. Enter your medication or medications, and GoodRx will show you the pricing for your prescriptions at all the pharmacies in your area. Choose the pharmacy you want to use, and when you fill the prescription, tell them you would like to use GoodRx instead of your medical insurance. They will most likely request a member ID or some other information, which is always shown very clearly in the GoodRx website or on the smartphone app. It is always a good idea to do your research. For example, if you go to the drug company's website for an expensive prescription you may find out that they have a coupon for the drug that you can use at the pharmacy without even running it through your insurance. We will be terminating the Garner Health HRA for the plan year effective July 1st, 2024. The last day you are eligible to incur a claim that is eligible for Garner HRA reimbursement is June 15th, 2024. You'll have until June 30th, 2024 to file for reimbursement for any claims incurred between January 1st, 2024 and June 15th, 2024. Please be on the lookout for regular communications from Human Resources and Arista regarding the termination of the Garner HRA. You may also email Garner at concierge@getgarner.com with any questions you may have. New York Life will allow employees to elect the following plans with no medical questions asked. Voluntary short-term disability. This benefit pays 66.67% of your weekly salary for up to 13 weeks. Voluntary long-term disability. This benefit pays 60% of your monthly salary until you can go back to work or until you reach your normal Social Security retirement age. Consider protecting your income with disability insurance. Some of us may have insurance on our smartphones, but not on our paychecks. If you cannot afford to purchase both short and long-term disability, consider at least long-term disability if you must choose between the two plans. Sometimes people can find a way to get by for 13 weeks with paid time off they've accumulated at work, accrued sick time, by dipping into savings, or getting help from friends and family. However, what if you could not go back to work for a much longer period, or worse, maybe never? It is highly recommended that you consider both short and long-term disability coverage for full protection of your paycheck. You also have the opportunity to purchase or increase your voluntary life with AD&D insurance up to $150,000 with no medical questions asked. You may also purchase or increase up to $75,000 with no medical questions asked for your spouse. Children up to age 26 are always guaranteed $10,000 in life and AD&D insurance. You can cover multiple eligible children for just one premium. If you purchase spouse and/or child life, you, as the employee, are automatically the beneficiary. However, make sure you designate a life insurance beneficiary for the life insurance policies you have. Butts County provides a life insurance policy worth 1 times your salary up to $50,000. Your spouse gets $5,000, and your child or children up to age 26 get $25,000 worth of basic term life with AD&D at no cost to you. Everyone who is eligible for benefits has this policy. So if you did not know about this, it may mean that you're not sure who you have assigned as your beneficiary. Please make sure you check. Remember that Arista is here to help you better understand your benefit offerings. please do not hesitate to call Arista at 866-370-3119 or email them at help@aristacg.com. We also have put together a benefits website for you. Please go to butsbenefits@touchpointsonline.com or scan the QR code with the camera on your smartphone to take you straight to the website. Thank you so much for your attention to this important information. We hope this presentation was helpful. We appreciate you.